Please keep your device muted and your video turned off throughout the program. That allows everyone to hear and see well. For your convenience, this program will be recorded. Following the presentation, the recording presentation slides will be shared with all registered participants. So don't worry if you miss something, you'll get another chance to see it. Okay, so again, I'm Dr. Timothy Watkins, and with me is Dr. Andy Reyes-Santos, a pediatric resident physician here at the Hackensack Meridian Medical Group academic pediatric practice. We're a practice affiliated with Hackensack Meridian Children's Health.
Good evening, everybody. I'm Dr. Reyes. I'm happy to be here, and I'm happy that you guys are able to join me tonight, along with Dr. Watkins, to just go over some of these topics.
Right. Thanks, Andy. Let's see. Symptoms of COVID-19 children. Why don't we start there to just get an overview of our topic tonight? So I think it's important for families to know that overall, the way children are impacted by COVID-19 is definitely different and definitely less than the way adults and other populations are impacted. And that's kind of a really important take-home message right from the top. Serious infections in healthy children are uncommon. There are some groups that may be at somewhat higher risk, but overall, it's unusual to see serious infections in children. Only about 2% of all cases of COVID-19 in this country are in those in the pediatric age group, so aged less than 18 or so. The groups that appear to be at somewhat higher risk are newborns, are children with maybe an immune system that isn't working as well, some compromise to the immune system. So there's a lot of unusual conditions that could affect children as well as adults that affect the immune system. Maybe a syndrome called lupus or certain types of arthritis like rheumatoid arthritis in children, or Crohn's disease. These are all unusual things. Maybe children with cancer or kidney problems, or something maybe a little bit more common in children is moderate to severe asthma. There are children with diabetes, and they may be at increased risk for complications and serious illness with COVID-19. Maybe some children with serious heart conditions as well. Let's see. The important thing to remember when thinking about children with COVID-19 is that the symptoms really overlap with so many other conditions, both common conditions like the common cold, and more rare conditions. And we'll talk a little bit more about that later. So hopefully through our talk tonight, through our time tonight, you'll have a better sense of when to call the pediatrician or maybe seek emergency care if that's needed. So one of the key things that I hope that everyone will start to think about by the time we're done with our talk tonight, if you haven't already, is what resuming regular scheduled pediatric care will look like, and understanding how important it is. The American Academy of Pediatrics, which provides guidance and resources to pediatricians all over the country through our professional associations and through our training, recommends in-person regular checkups whenever possible. It seems like that might not be the first thing on your mind during this time. Excuse me, I advanced slides mistakenly. So it might not be the first thing on your mind, but actually it's really important. We really would like to emphasize in today's climate that we're going to work to keep your child safe when you come to the doctor. We want you to know that the immunization schedule that we've all worked so hard on will continue and should continue, and that children will need ongoing care, ongoing care um, through this COVID-19 pandemic.
If you guys could just, as a reminder, just mute yourselves during the presentation. Thank you.
Good, great. So, and it's also possible to do some sick visits. And again, we will take the necessary precautions to make sure that goes as smoothly as possible and with as little risk for anybody, including you as a parent, your children, or the staff at the office, or us as physicians to be protected from COVID-19. Let's see. I'm going to move to the next slide. What to expect in an in-person visit. So again, although they're important, they may happen a little bit differently than what you remember from the previous time. So it's sort of like a new normal that everybody's been talking about. The waiting room might be different. There may not be any time that you spend in the waiting room. For example, many offices might be having families wait in their car and be escorted up. Maybe one parent comes in and one parent stays in the car during the visit to minimize the exposure among people during the visit. There might be a special location for patients when there's concern for COVID-19. For example, I know in our practice, we have a certain room that we keep designated and always available in case unexpectedly we feel like we might be in a circumstance where COVID-19 needs to be considered. We do always want you to call ahead so we can help prepare you for this and talk it over. So call our office and we'd be happy to tell you kind of what to expect. We may at that time suggest a virtual visit. It might be the sort of concern that might better be addressed over either the telephone or an audio and video visit to sort of figure out if further care might be needed. And in many of these virtual visits, the entire cycle of care from the concern to the evaluation to testing to follow-up to can all be addressed at that virtual visit. In many cases that can happen, but in some cases we will ask you to come in because we need to actually see the child or weigh the child or measure a vital sign or do a part of the exam that can't be done by audio or by video. So with these in mind, we really want you to keep keep us in mind and don't hesitate to call if your child is not feeling well. And really that's very similar to what you might remember from before.
I just want to add, sorry, I just wanted to add to that by saying that, you know, these visits are actually, they're already happening. And they are actually, we've gotten some good feedback at our practice, with the emphasis that each pediatrician's office may do things differently. And so it's imperative to really call beforehand, and so that they can take measures to protect, you know, your family as well as other families. Like we mentioned in our office, we have a separate room that if maybe there's a concern for COVID, then maybe they can designate and start getting that room ready. And I know at our office, for example, we take measures to make sure that all of the hand washing stations and like Purell stations are available. And again, not really the check-in, check-out process has changed so that there's not like a grouping of people in one certain location. The other thing is that part of the visit may actually be online with telemedicine in order to shorten the duration of time that you would have to even be in the office. I know that at our practice, we are doing certain visits online via telemedicine, and then maybe just coming in to make sure that we get vital signs, await, and then administer those vaccines so that you can be on your way and sort of minimize the time that you're there. So each office is taking different measures, and so that's why it's also really important to call beforehand.
Thanks so much. That was, yeah, that's very, really important. Um, Telemedicine visits are a little different than in-person visits. Of course, you're usually not, you typically would be at home or somewhere else where an internet connection is vital for us to see and hear kind of what the concern is and what's going on with your child. So a good internet connection is really helpful. A larger screen allows us to see better what there is, what's important to see. Sometimes having a device stand or a holder for a phone or tablet can be really helpful. Maybe putting a mat down or a blanket down on a floor and having the child examined on the floor can sometimes be helpful. A place with good lighting, maybe not too much background noise, can also assist us, and so we can help your child better. And sometimes an extra pair of hands, sometimes either to hold the phone or to hold the child. In some cases, a toddler might be very active, and an extra pair of hands could be really helpful. Occasionally, a scale can even come in handy. We might ask you to hold your child and then step on the scale and then pass off your child and get back on the scale, and we'll get an estimate of the weight of the child from in that way. So there's lots of things that you might not think of that we can do by telemedicine that are super helpful, and also a little different. There is one topic which a lot of people have been hearing about recently, and it's certainly been in the news, and it's certainly been on our minds. The name of that is Pediatric Multisystem Inflammatory Syndrome. And that is a new name that most of us have never heard until very, very recently, because this appears to be a new condition, and it does seem to affect children and seems to be very relevant to pediatric care. And so while we do want to explain it a little bit during our talk tonight, we don't want you to be alarmed by it. Not that it can't be serious, it certainly can be serious, but again, it's important to remember that it is not common. It is in fact rare. There are many cases, but there are also many, many more children than cases. There's a large group of children, and most of them don't have this. So we'd like to go into it because it's been such a topic of interest, and to us too as physicians, but we don't want to alarm you at all. So it's actually a collection of symptoms, and it doesn't have necessarily a direct cause from COVID-19, but it certainly could be linked to COVID-19. Absolutely, there's a possible link with COVID-19, either active infection or a recent infection or a prior infection. So it consists of a set of symptoms such as fever, usually for a couple days, bright red eyes, a rash, often the hands or feet may be swollen. There might be vomiting or diarrhea or abdominal pain. And then there's some other symptoms that are uncommon, confusion and extreme weakness among them. Sometimes these symptoms are very severe in children who have this syndrome, and it can even be life-threatening. But again, it's quite unusual.
Yeah, can I just add? So this syndrome, and some of you may be hearing the term Kawasaki in the news, which you may or may not have been familiar with. That's kind of an entity, a syndrome that we are familiar with from long before the COVID era. And the reason why that term is coming into the media and people's attention now is because, like we said in the beginning of the presentation, there's a lot of overlap. There's a lot of overlap with conditions that are, both common, like any regular virus that we would expect in a normal, flu season, or that can affect children, can have, rash, can have swelling or redness of the eyes, like viral conjunctivitis, it's referred to as. But really, the emphasis is to keep in mind what the overall child looks like. And so if they have some swelling here and there, some rash, but they otherwise are like energetic, they don't have any fevers, they're eating and drinking just fine, then there's a lot less concern, because it doesn't necessarily mean that this is what they have. Now, if there's ever any concern, then we always encourage that you reach out to us or your pediatrician to go through some of the symptoms that your child is experiencing, and we can definitely, it really has to be a case by case basis, because like I said, this is new. And so some of the reasons that might lead you to go to the emergency room are what normally would lead you to go to the emergency room with your child, regardless of whether it's this or not. So, if they are becoming dehydrated because they're just having so much vomiting and diarrhea, if they are, if you're unable to reach your pediatrician for any reason and are having some of these concerns, then, by all means, you should go to the emergency room or seek further evaluation. But like Dr. Watkins was mentioning, they're really not that many cases in the grand scheme of things in the United States. And so because it's happening doesn't mean that it's very common. And so that's why we just wanted to bring it up,
Right.
so that you're aware.
Yep. And we look forward to having the chance to bring updates to that, because this is rapidly evolving and we're learning more as the weeks and months pass. So there's a lot of interest, and there may be new information about this topic over the next months. And so thank you, Andy. And let's see. We have some time for questions and answered. We did get some questions before our talk today, and we worked through some of these answers as best we can. So I'd like to take this second part of our time together to kind of talk about some of the responses that to answer some of the questions and concerns that were raised prior to the scheduled time tonight. Andy, do you want to take the first one about recommendations for resuming outdoor summer activities?
Sure. So first of all, thank you all for submitting all these questions. They were amazing questions. We didn't have unfortunately the time to get through all of them, but we picked a few that we think are very relevant for everybody. So recommendations for resuming outdoor and summer activities. This is a great question as we move into the summer months. People want to know, is my child going to be able to participate in their summer sports? Are they going to be able to go to camp and the pool, swimming pool, and those kinds of things? So really, it's going to be difficult to predict and to guarantee safety, essentially. There may be some activities that the municipalities may allow, but things like the pool, where inherently a lot of people are going to congregate, that may be more difficult. Things like sporting activities may be more difficult, because inherently those activities require that you're either passing a ball from one person to the next, that you're either having physical contact, and so it would be very difficult to kind of, keep a closer eye on what's happening during those situations. Now, there may be some activities, like, for example, band, where everyone's playing individual instruments and may not have to be in such close contact with each other, where they may look at making available first before they make available some of those activities that require sort of direct contact. Again, it's going to be individualized per municipality, per school district. All those things are going to be individually tailored, but it's going to be hard to predict, but there'll be more to come as the summer nears.
Thank you. And as fall comes after summer, sports physicals might be a topic. And some folks were wondering whether they could still get sports physicals. So if there are sports, we anticipate that having sports physicals could still be done. I guess sort of the sports have to come first, and then the sports physicals. But that shouldn't be a concern in most pediatric practices, as best we can tell. So that's sort of like a follow-on to what Andy said previously. Okay, recovering from COVID-19 and protecting others in the household. Andy, do you want to start on that one?
Yeah, absolutely. So this also was a great question. We got some questions about people who are saying, well, I tested positive for COVID, I was sick and had symptoms. So when can I, hug my family again, kiss my child again, have physical contact as we would before? So there are actually guidelines that were recently updated as of the end of April. And so it varies for if the person is immunocompromised, meaning if they have some sort of condition that is lowering their immune system, and then B, it's different if you are not immunocompromised, meaning before all of this, your immune system really was just a regular immune system. So if you were generally healthy before this, the recommendation so far is at least to continue face covering for 14 days. So that's 2 weeks from the date that you were tested, or it's an or, until that cough or symptoms resolve, whichever one is longer. And so that 14 days, again, it's just either from the time that you were tested or until your symptoms resolve. And then in addition to that, if you were having fevers, you should have not had any fevers within the past 3 days. So we talked about the 14 days from either test date or the date of symptoms ending. And then in addition, you should be checking your temperature and have no fever for at least 3 days, and that's without using any medicine to keep the fever hidden. So without having to use Tylenol or anything to keep it hidden. By all means, if you need to use it, then use it. But these are guides that will sort of dictate whether or not your body on its own is still having fevers. And all of those criteria sort of have to be met in order for us to say, okay, kind of continue the way that you were, having social distancing and everything before you knew that you were sick. That's for regular, not immunocompromised patients, which are going to be probably the majority of people. There are, 2 options for the immunocompromised patients. A big difference is that 14 days is lengthened to 28 days. And so it's the same sort of rules as for regular healthy people, but so from the date of the test or until symptoms resolve, it's 28 days, whichever one is longer. And then still 3 days without any fever, without the use of any fever
Yep.
reducing medicines.
And
And
go
yep,
ahead. And don't remember, you don't have to remember all this. You're getting slides at the end of the talk, and you can always ask your pediatrician. So,
for sure. Yeah, at the end of the day, if these are guidelines, and so clearly, if somebody is still looking like they are sick, and you have further concerns, and you'd like to wait longer, then obviously you should feel safe and following the recommendations of your pediatrician. But just so that you guys know, there are some guidelines out there, and the main thing to remember is that 2 weeks after the test date and without any symptoms.
great. Thanks so much. So, breastfeeding, for those of you who might be expecting, or maybe you currently have an infant who's breastfeeding, we can give some general guidelines. I'll just go over them kind of quickly. So if there's no specific concern for either mother or child, breastfeeding child, having symptoms of COVID, we recommend breastfeeding just like before, in the same and usual way, with just regular breastfeeding in the regular way. If the breastfeeding mom is suspected to have or is known to have COVID, there are some special precautions that we would recommend, such as expressing the breast milk, and maybe some additional steps that you can take as well to prevent directly infecting a child with COVID during breastfeeding. If that's the case, where you as the parent might be COVID positive and the infant is unknown. Certainly talk to your pediatrician and we can go over that in more detail. Andy, did you want to add anything to that answer as well?
Yeah, the main thing is if you have a mom who is known to be positive for COVID, then she should wear a mask, first of all. Second of all, like Dr. Watkins said, she should be expressing the breast milk to minimize direct contact on the breast. And before expressing the breast milk, she should wash her hands as well as wash the breast, which is, different from what you may be used to, which is just kind of washing your hand. So washing the breast and the hands, wearing a mask, and then if possible, having another caregiver who is not sick, bottle feed the baby with mom's expressed breast milk. That's the current recommendation from the Academy of Pediatrics.
Great. So a lot of families asked about quarantining children, how that could happen and what that might look like. That is sometimes really hard with young children. So there isn't a one size fits all answer to this question or answer for recommendations for this topic. But in general, using common sense and for age appropriate care is appropriate in the home. Older children might be able to be quarantined in a more meaningful way, but for very young children, it's often not possible. The adult might be quarantined, but usually not the child. And sometimes other caregivers may have to step in. Helping children develop normally at home is also a concern that many families asked.
Can I just add one thing?
Yep,
Sorry,
yep.
Dr. Watkins. So just for the quarantining of small children, I just want to also add that the Centers for Disease Control, they do recommend, it's okay to put a mask on your child, but really that child should not be wearing a mask if they are less than 2 years old, or really in anybody who can't readily take the mask off on their own. It should be somebody who, in the event that they really need to, they have the ability to take the mask off on their own.
Really key, yeah. So we don't want any other accidents from the masks, right? Yeah. So helping the child develop normally at home and coping with trauma and loss are also really important concerns. And there again isn't a one size fits all answer to this. But in the absence of lots of social interactions with other kids, the interactions with siblings and parents take on more importance. And it's really key that you continue to engage your children in healthy, normal, regular activities. Some of them might be fun, some of them might be chores around the house, maybe gardening, or maybe doing regular things in the house to help the family. Those are all things that support normal development and normal connections within the family. Children are going to have and have had a hard time with the social distancing that's been so important in getting on top of this pandemic. But there are things that you can do in the home to help minimize those. Andy, did you want to add anything to answering of those two questions?
I think you said it perfectly. There's been a lot of concerns about, my child is not having play dates, is not going to school, interacting with other kids their age, and that's okay as long as, the parent is still, talking to the child, reading to the child. These are things that in pediatrics are proven to help a child's development, whether or not, it matters a little bit less who it is, rather how you do it, and how often you do it.
Right.
And coping with trauma and loss is a difficult topic really to touch upon, just because everybody's so different. Some people cope with trauma and loss in a way that is very private. They may not want to talk to anybody about what's going on in their family, or anybody who might be sick that they know. I think one of the most important things that we can all do is really try and just allow people to know that we're there to listen. And it's okay to say, to somebody, I know that a lot of families are having a difficult time through this. How are you doing? And that just allows people to know that you are available to talk in the event that they want to bring things up to you and talk about those things. So it's a tough
Yeah.
topic.
Yep. Listening can sometimes be the first step and sometimes even the most important step in helping children through this difficult time. I agree. I think our last one is about patients who may not have symptoms or patients who may have internal damage, maybe to internal organs or some unrecognized complication from a COVID-19 infection. And again, this is a challenging topic, a really good question, but a challenging one. As we learn more and more about this infection, we are learning more and more. We are learning that some children will have symptoms maybe weeks after a prior infection, and the symptoms may overlap with a number of other conditions that might even be quite rare. And we talked a little bit about overlap with symptoms of Kawasaki disease earlier on. And there may be further things to discover. Certainly a lot of children are completely asymptomatic. That doesn't mean that they are unaffected, and asymptomatic patients, children included, can certainly pass the infection to other children or other adults. So there is concern about asymptomatic patients, both as potentially spreading the disease and also potentially as having complications themselves. There isn't a one-size-fits-all advice. It sort of depends on what the circumstance of your child is and what the symptoms might be, but it's certainly important to listen to your child, to observe, and to contact your pediatrician or your provider to see if additional steps in evaluation could be helpful. Andy, do you want to add anything to that as we close up?
Well, just to mention that right now there's not really any literature, any evidence that that patients that are asymptomatic, meaning that they're not having any symptoms at all, are having some major internal sort of trauma or damage to their internal organs. Again, we don't know what's going to happen in the long term, but if there's any one takeaway message from this entire presentation is to keep an open communication with our office or your own pediatrician for any kind of concerns that you may have.
Yep, I certainly second that. So we are moving on to a closing here, and I want to first thank everybody for joining us tonight. Thank you for giving us your valuable time. There will be a feedback survey coming through the mail to give us some feedback so we can do even better next time and figure out how to improve and what questions might be important to address in subsequent webinars. Please remember that virtual appointments are available with many of our providers at the Hackensack Meridian Medical Group Pediatrics practice. The contact information is there. You can certainly reach us in many different ways, and you can certainly contact either myself or Dr. Reyes-Santos by calling that number at 551-996-9175. And we work at the Pediatric Academic Practice, which is a practice within the Hackensack Meridian Medical Group. Okay, folks, I hope that was helpful. We really appreciate your time, and thank you so much for joining us this evening. Have a good night and be well.
Thank you all again. Have a good night.